All right, welcome back. Our next guest, Dr. Percy Balderia, a rheumatologist from the Polyclinic. We're talking about arthritis, not just arthritis, gouty arthritis. So I guess this is a pretty nasty combination, it sounds like.
Yeah, absolutely, Tom. The word gout just scares me. If you've ever seen it or had patients that have had it, it's painful. We're going to learn a lot about it today.
All right, let's check in with Dr. Percy Balderia, rheumatologist from the Polyclinic with Shannon O'Kelly.
Dr. Balderia, welcome. How are you doing today?
Very good. Thank you for having me here.
Well, thanks for coming down. I want to talk to you about a couple things, but first of all, let's talk about your practice, and more importantly, let's talk about being a rheumatologist.
Mm-hmm.
You know, we don't talk to rheumatologists often, but we're certainly excited to have you here because we're going to talk about gouty arthritis, which is super painful, and folks have it. But tell us about
My dad has it, actually.
Your dad has it. So is that your interest in rheumatology, or how'd you get interested in rheumatology?
Well, I practice general rheumatology. I'm with a Polyclinic with a focus on gout, rheumatoid arthritis, and psoriatic arthritis. So I like doing rheumatology because I can develop long-term relationships with patients, and we have so many different medications that we can, help control patients' joint diseases and give them a good quality of life.
And as a rheumatologist, tell us about your training. Tell our listeners about your training. And then you talked about, you get to know your patients. So that was an interest of yours, going through medical school, really developing relationships. And these patients that you treat them for a long time.
That's true. So I did my residency training at the Albert Einstein Medical Center in Philadelphia. And that really got me started into liking rheumatology. And then I went here in Seattle to train at the University of Washington Medical Center, which is one of the biggest training programs for rheumatology and the only one in the WAMI region.
And tell us about rheumatology and tell us about the diseases that you treat. These are these autoimmune essentially, I'm going to kind of try to summarize a little bit here and be brief, but the body kind of attacks the body in a way, and you're trying to discover and figure out what's going on there?
So that's right. So we treat autoimmune diseases like lupus, mixed connective tissue disease, and also inflammatory arthritis like the ones I mentioned, gout, pseudo-gout, rheumatoid arthritis, and psoriatic arthritis. So normally your immune system is meant to deal with infections, but sometimes it gets confused. Maybe part of it is environment, part of it is due to genetic predisposition, and it attacks your own cells.
And you talked about environment. I mean, are there identified environmental conditions that can predispose a patient or a person to these rheumatological diseases? And then you talked about genetics. Maybe talk about that a little bit.
Let's talk about gout in particular.
Okay.
So for gout, so certain genetic predispositions make you more prone to have gout, but it certainly is not enough. It is estimated about 40 to 60% of the risk of gout is attributed to genes, but only less than 10% of those genes have been identified so far. So you may be predisposed to either produce more uric acid in your body or to excrete less uric acid through your urine. And then in terms of environment, well, if you have a lot of purine load in your body, you produce more uric acid. So excessive alcohol, drinking, especially beer, high purine-rich diet like red meat, gravies, liver, shellfish, and sugary drinks. They all may predispose you or trigger gout flares.
Let's talk about gout. You talk about uric acid, but let's set gout up and what's going on there and what your body's doing. Let's talk about signs, symptoms, and treatment. Let's get into gout here because it's painful.
It is.
And so tell us about gout. I mean, maybe some physiological standpoint. You talked about uric acid. So tell our listeners why high levels of uric acid predispose you to gout.
So when you have high uric acid levels, they deposit in your tissues, including your kidneys and in your joints. And then your joint reacts to the crystals when they build up, and it causes inflammation, which manifests as pain and swelling. And it can be really painful, as you mentioned.
And is there a certain part of your body that, I've often heard of gout in particularly the big toe, the great toe. Is there any other places in the body that you might see gout?
So you're right. Gout has its favorite joints. We don't exactly know why, but the big toe is one of them. Also the knees, ankles, and wrists.
So knees, ankles, and wrists, but big toes. And this is, again, these crystals go into that joint. That joint triggers inflammation. You have pain and swelling and a lot of discomfort.
That's right. But it can practically affect any joint. I've seen someone with gout in their spine.
Hey, Shannon, is gout something that is treatable through physical therapy?
Well, we might see the results of gout, but, the gout needs to be treated medically, but we see the sequelae or the results of it
All right, we're going to continue our conversation with Dr. Percy Balderia, rheumatologist from the Polyclinic, right after this time out on IRG Physical and Hand Therapy's Health Talk on KOMO.
Dr. Balderia, thank you again for coming down, and thank you for talking about gout and being a rheumatologist. I mean, I find you guys and your practices, particularly rheumatology, fascinating. You're like this detective trying to figure out the body, and we've been trying to figure out the body for a long time, and we're talking about gout, and you talked about kind of what happens with it, uric acid, the crystals, painful joints. How does a person know they have gout, though? I mean, how do I know I just didn't irritate my toe and stub it, right?
So that's right. The typical manifestation is that you get sudden, intense pain and swelling, usually in one or two joints, but it can be several joints. As you mentioned earlier, it's usually in the big toe, but sometimes the knees or the ankles. You want to make sure that it's not an infection. So if you got to search for a wound in the area, that it's not from a previous trauma like a fall, make sure that there's no fracture there.
And so you're going to have pain, swelling, and redness in these joints, and it hurts to move. Is there night pain, or is it mostly with activity, or is it all the time that people complain of pain with gout, particularly in the joint?
Well, most people have pain all the time, but especially with movements of the joint, just slight movements. Also, a lot of my patients experience skin hypersensitivity. Sometimes just a blanket over their knee makes it hurt so much.
And if I come see you and I think I might have gout, how are you going to identify, diagnose it, and more importantly, how do you treat it in today's world?
Well, to definitively diagnose gout, we remove joint fluid, look at it under the microscope, and then we try to find uric acid crystals. But again, if you suspect they have gout, it's best to see a rheumatologist, as you said, because we can diagnose gout and make sure that it's not some other form of arthritis.
Good. So I've got gout. I've been diagnosed with it. How do I treat it, and how do you treat it?
The management of gout is twofold. One, you want to control the pain and swelling associated with the flares because it's very uncomfortable, right? And people miss work. And you also want to prevent future flares to avoid long-term joint damage and prevent disability or secondary osteoarthritis.
So if I have gout and I can treat it, and you can help me treat it with modified maybe lifestyle, diet, fluids, maybe some medication. Does gout return? Do people get it again and again and again? Because I know patients that have had it several occurrences over the years.
So you're right. So gout tends to recur and have flares. So for flares, as I said, you can control it with anti-inflammatory drugs. We can do steroid injections, or you can take ibuprofen, colchicine, or steroids. But for long-term control, you want to lower your uric acid level. So it's good to have a healthy diet, maintain an appropriate weight, but studies have shown that that's usually not enough to lower your uric acid to the goal level. So there are several medications available, like allopurinol, febuxostat, lesinurad, and probenecid, and some of them you can take in combination. You really have to talk to your doctor to see what's best for you.
And so what about activity? Is it important to stay active?
Well, it is important to stay active, but not when you have a flare, because you have ongoing inflammation in your joints, and it might, damage your joints more if you put too much weight on it.
Well, once again, thank you for your time. Gout is really painful. I've seen a ton of patients with it, and they are so happy when it goes away. Thank you for your time.
Thank you.